Welcome to the Head and Neck Center. I'm your surgeon, Dr. John Caniglio. I'm an ear, nose, and throat fellowship-trained head and neck surgeon serving the community for over 25 years. Our practice is affiliated with the University of Rochester as well as Rochester Regional Health. This brief video will prepare you for your upcoming surgery. If you have further questions, please ask our physician assistant today, and of course, visit our website. You'll be undergoing surgery for removal of a mass or lesion in your head and neck. Tumors can be benign or malignant, and your specimen will be sent to pathology. Some of the benign masses, better known as lumps and bumps of the head and neck, include lymph nodes, blocked salivary glands, and skin lesions. Malignant tumors are treated with surgery followed by chemotherapy or radiation therapy. If your lump or bump is small, your surgery will be an outpatient procedure and you will go home the same day. Most inpatient head and neck surgeries require a 1 to 2 day hospital stay to monitor drainage, swelling, airway, and your nutrition. If your surgery is a neck dissection, an incision will be made from behind your ear to the middle of the neck near the windpipe. We typically preserve vital structures such as muscles, nerves, and blood vessels while removing the lymph nodes in your neck. It is common to have intermittent swelling, tightness, itching, tingling, numbness, redness, or discomfort for up to 6 to 12 weeks following surgery. We ask that you avoid driving for 1 week after surgery. When you arrive at the hospital or surgical center on the day of your operation, you will meet your anesthesiologist and the nurse will be in the room for the duration of your surgery.
Dr. Caniglio, what do I need to do to prepare for surgery?
Well, for 1 week prior to surgery, avoid aspirin, ibuprofen, or any other medicines such as blood thinners. Tylenol or acetaminophen is always okay. Please tell your nurse about any herbal supplements or alternative medicines such as ginkgo biloba or St. John wort, as these may cause bleeding.
May I take my daily medication?
Continue to take your daily meds in the weeks leading up to surgery. Your anesthesiologist will instruct you into which medicines to take on the day of surgery. These medicines should be taken with just a sip of water. If you have any inhalers, make sure you take a dose the morning of surgery and bring the inhaler with you.
What if I get a cold or an upper respiratory infection the week before surgery?
Just call the office. Usually surgery is not canceled due to a cold only. We may start you on an antibiotic before your surgery.
Is there anything else I need to do to prepare for surgery?
Yes, please do not eat or drink anything after midnight the day before your surgery unless otherwise instructed by your anesthesiologist.
What time is my surgery?
The time of the surgery is set by the hospital or the surgical center. Our scheduler will give you a number to call the business day before surgery to find out what time you need to arrive.
What happens on surgery day?
You should do your usual morning routine the day of your surgery. It's okay to brush your teeth. When you arrive at the surgery center, the nurse will take your vitals and place an IV. Your anesthesiologist will listen to your heart and lungs before he or she puts you to sleep. I will also see you before we go to the operating room to answer any remaining questions you may have.
Will I be asleep for surgery?
Yes, your surgery will be performed under general anesthesia unless you've been otherwise notified.
How long is the surgery?
Most surgery takes between 1 to 2 hours. Major cancer cases can take several hours. A family member or friend should be available to be contacted with updates.
What should I expect after the operation?
Post-operative pain can be easily managed using prescription oral pain medicines. Anticipate numbness and swelling of your neck, but infection is rare.
How long will I be in the hospital?
Most patients stay 1 to 2 nights in the hospital. If it's an advanced head and neck cancer case, you will stay in the hospital for 1 week.
Do I need to arrange for transportation after the surgery?
Yes, you must arrange for transportation and have a responsible adult available for you the first night at home.
Does surgery affect my ability to sleep?
It is important to sleep with your head elevated on 2 to 3 pillows for the first week after surgery to prevent swelling.
What prescription medications will I need to take?
You'll be provided with 2 prescriptions for use after your surgery. The first is an antibiotic to begin the day after surgery. The second is a prescription narcotic to be used for pain management. Pain medication can cause nausea or constipation, so always take it with food and use a laxative if necessary.
When should I resume my daily medication?
Resume your daily medications the day following surgery, but we will advise you about blood thinner use.
Are there any special wound care instructions?
Before you leave the hospital, any drains or bulky dressings will be removed. Steri-strips will be glued in place so it's okay to shower. On the next day, remove the clear dressing covering the gauze over your drain site.
When should I come in for a follow-up visit?
You will make an appointment with our scheduler to come back 2 weeks after surgery. Occasionally, a suture removal is required at 7 days.
Are there any instructions for external wound care?
Yes, ice to the wound for 48 hours and elevation for 1 week is always a good idea. To limit scarring, make sure you apply sunscreen to the surgical site, and after 2 weeks, you can use topical creams such as aloe vera, vitamin E, and Mederma.
How long should I expect to be out of work?
Typically 1 to 2 weeks after surgery. Aerobic activity should be avoided for 2 full weeks. Do you have any more questions?
No, I think you've covered everything.
Great. Make sure you review the written material provided a few more times prior to your surgery. Thank you for your attention, and thank you for choosing the Head and Neck Center. Our physician assistant will be in shortly to answer any further questions.